Welcome to QRME's General Practice Exam Preparations Introduction to the RACGP Written Exams. So this is just a brief video to give you a little introduction to the written exams and also to give you a few what I hope are helpful tips along the way. As I'm sure you're aware, there are two RACGP written examinations. The AKT is 150 questions in 4 hours, and that is made up of 70 single best answers and 80 extended match questions. This will mean that you'll have 1.6 minutes per question. The KFP is 26 questions in 3 hours, meaning that you'll have 6.5 minutes per question. I really do encourage you to practice your questions with a timer so that you get used to knowing how long you have for each question. You should be aware of several changes that the RACGP has made recently to the exam requirements. So from January 2017, there is a requirement for examinees to have passed both the AKT and the KFP prior to being allowed to sit the OSCE. Previously, you were just required to pass the AKT. The other important point is that exam results will now expire within 5 years, so candidates will be required to apply for their fellowship within 5 years of passing each segment of the exam. And the final change is that if you live more than 2 hours or 200 kilometres from an exam centre, you can request to sit your exams remotely. Obviously, that doesn't include the OSCE. In this video, I'll be first of all reviewing the computer familiarization, then we'll do an AKT review, a KFP review, and finally I'll give you some general hints and tips. As I'm sure you're aware, the written examinations are now completed electronically. I really do encourage you to review the videos on the RACGP website that introduce you to the program that the RACGP uses. As mentioned previously, the AKT has 70 single best answer questions. There is one correct answer from 5 options, and there's no negative marks for incorrect answers. You'll see an example below, and this is a pretty easy one. As you know, obviously the correct answer is C, rheumatic fever. The AKT also has 80 extended match questions, which can be a little bit more tricky because you've got up to 26 options from which you need to select the most likely or the best answer. Once again, there are no negative marks for incorrect answers, and you'll see that there's an example below. So as you'll see with the extended match questions, you're given several question stems and then you need to select answers from the list of answers that you're given. So you can have a go at these, and on the next slide you'll find the answers. Some of my tips for the AKT are try and work out your answer before you look at the options that are available. Sometimes it can be quite confusing, particularly with the extended match questions. And if you look at all the options, you can get yourself in a bit of a mess. But if you just try and figure out the answer ahead of looking, that can really help you. Remember that there are no negative marks, so if you don't know, please just do give some answer. And your timing, so it is one AKT question in 1.6 minutes, so some people do feel a little bit of time pressure, so it's good to practice that timing as much as you possibly can. With this slide, I hope to give you a bit of an insight into the wording that is used in the written exams. So, for example, if they're saying never, always, or exclusively, that means that there's no exceptions. If it's an essential feature, that means that this feature is required to confirm a diagnosis. And of course, characteristic, typical, commonly, frequently means that there should be a frequency of more than 50%. So here are some strategies to answer difficult questions. I really do encourage you, if you come across a difficult question, please just flag it and come back to it later, because timing can be a bit difficult, and you'll note from the computer familiarization video that they'll show you how to do that. So if you do come across a difficult question, first of all, eliminate the options that you know to be incorrect. Sometimes, on occasion, the grammar can help you. So if the grammar in the stem doesn't match with the grammar in the answers, then perhaps you could exclude one of those options. Eliminate options that are totally unfamiliar to you. So if you've never heard of a condition, it's probable that that's not going to be the diagnosis. Question options that contain negative or absolute words. So as you know, in medicine, it's very rare that something will always happen or that something else will never happen. So it's very important to exclude those options.
And finally, if you know that 2 or more options are correct or incorrect, then obviously you can select all of the above.
So if you really don't know an answer, then I do encourage you to do an educated guess. As I mentioned, there's no negative answers, so you really do want to have an answer for every question. So if you're not sure, guess. Use hints from questions that you know. So the reason I say to come back to a question that you're not sure of is because sometimes as you progress along the exam, you'll find that there will be answers there for you that you can use in previous questions. Do go with your gut a bit. So only change your first answer if you're really, really sure of the correction, because very commonly people will change an answer only to select an incorrect answer. Remember that you're looking for the best answer. So sometimes you'll find that there might be more than one correct answer, and what you're wanting to select is the one that is the most correct. Remember those keywords, never always exclusively, they're generally false and could or possibly may often be true. Statistical statements that state an exact number, for example 12.9%, are often wrong because you're usually not required to know such specific information. And remember that if information is unfamiliar to you, so if you've never ever heard of a particular condition, then it's likely that that's not going to be the correct answer. So now we come to the KFP review. The KFP is often the exam that people find the most difficult, so hopefully I can help you make it a little bit more clear. The KFP is 26 key feature problems in 3.5 hours, and points are weighted equally. So while the AKT is designed to test your knowledge, the KFP is designed to test your clinical decision making. Each clinical scenario is then followed by questions that are around that particular case. Partial marks can be allocated if your answer is not complete, but do be careful about putting extra information because marks will be deducted. So what is a key feature? It's a critical step in the resolution of a clinical problem. So as I said, the KFP is really designed to test your clinical reasoning and your clinical decision-making skills, and that's what these questions will be addressing. Okay, so here we have an example, and I'll give you a moment to read through the example. So when you're reading these questions, try to pick out what are the important features. So for me, here we have a young woman. She has severe diarrhea and nausea. Importantly, she is dehydrated. You can't really assess the degree of dehydration, but she is dehydrated. And she has children, and she works as a cook in a long-term care facility. So let's move on to the questions now. So question 1 is, what clinical problems would you focus on in your immediate management of this patient? So every word that they put in the question is important. These questions are reviewed over and over to be sure that they're as clear as possible. So be sure that you're reading clearly what clinical problems and immediate management of this patient. Question 2, how should you treat this patient at this time? Select up to 3. So basically at this time means now. What are you going to do for this patient now? And selecting up to 3 options. So often they'll write this up to 3, up to 6. You could potentially select less, but select 3 and definitely don't select any more than that. Question 3, after management of the patient's acute condition, what additional measures, if any, would you take? Select up to 4 or select number 11, none, if none is indicated. So now you've managed the acute problem, and what are you going to do after that? So now we come to the answers. So the answers for question 1 are: number 1, recognise dehydration. So of course we couldn't assess its level of severity, but we should have assessed based on her blood pressure, her dry mucous membranes, etc., that she was dehydrated. So that's very important. Number 2 is that we need to manage her dehydration. And finally, because she's a mum, and particularly because she works in that long-term facility, we need to evaluate the possibility of communicability. So this is a public health issue. So the answer to question 2 is number 3, enteric precautions. Number 7, notify public health authority. Number 8, stool cultures. And number 10, temporary absence from work. So obviously enteric precautions need to be taken. You do need to notify public health, and that's particularly because she works in that long-term care facility. Stool cultures should be taken again because she works in a care facility and she's a cook. So, if there is an outbreak, then we have a jump on what the problem is. And of course, while she's symptomatic and usually for 48 hours afterwards, depending on what the guidelines are, she really does need to be away from work. So here's some general information about the KFP. So it used to be that for candidates who had English that was not their first language, they got an extra 30 minutes, but now all candidates are given an extra 30 minutes. So essentially you should have plenty of time to complete the exam, but a lot of people do still find that they are time pressured. And particularly if your typing isn't fabulous, you might need a little bit of extra time. Be sure that you're answering in the context of the case given. So, there are examples of people who, if we're talking about hematuria and they ask you to list several causes of hematuria in this patient, and the patient is a female, somebody will have written, prostate cancer. So be sure that your answers do relate to the case that's given, and make sure you read the question properly. And we say over and over and over, read the question, but when you are time pressured, it is common for people just to fly through reading the question, but do take your time. Be concise with your answers. So a lot of the time they'll ask for note form, and that means that they certainly don't want a paragraph in your answer. When they're asking for 4 answers, it could be that there are more answers that you could give, but do stick to 4. There is negative marking in the KFP if you put too many answers. So if they ask for 4 and you put 5, you'll actually get negative 0.2 deducted from your paper for every additional answer that you put. So it's really important. People have failed the exam by 0.5 of a mark, and so having 0.2 deducted every time for each additional answer can mean a fail. In your answers, if you're having and, if, or because, it's likely that you're putting too much information and that you're actually giving more answers than are requested. Remember that most likely means the most common. So if they're asking you for the most likely cause of these symptoms, it's not just any possible diagnosis that could be causing it, it's the most likely. If it's the most important, then remember that you're looking for a significant disease that they're talking about. There has been some confusion in the past about what is examination, what is investigation, and so recently the RACGP has tried to make this a little bit more clear for people. So remember that examination is just what you're examining. SATs are included in this. Urinalysis can sometimes be examination and can sometimes be investigation, but it should be clear in the question as to which it is. With investigations, if they're asking you for multiple investigations, often you'll get a drop-down list, which will make it a little bit easier for you. Remember that ECG, HCG, INR, spirometry are all investigations, so please don't put them as part of your examination. Management can be investigations or treatment, but the question will let you know which it is. So I am going to harp on about overcoding because it is one of the most common mistakes that people make and one of the most common reasons that people fail the exam. So basically what the RACGP is doing by this rule is that if they ask you for a certain number of responses, they don't want you to just do a knowledge dump and write all of the possible investigations that you could do, because, you know, of course you could do every investigation for every patient, but that isn't actually going to help each patient. It's going to be far too many investigations. You know, it's going to cost Medicare too much money. So we want doctors who are doing appropriate investigations. So if they ask you for 3, make sure you list 3. Don't do any extras. A really common error is when people bunch investigations together. So as you'll see in this example, what are the 3 investigations that you would request? So if you write 1, blood tests, and list multiple blood tests, 2, radiology, chest x-ray, 3, ECG, you're actually listing, so FBC is 1, UEC is 1, LFTs is 1, ESR is 1, CRP is 1, chest x-ray is 1, and ECG is 1. So you're listing 7 different investigations here when they've only asked for 3. So you're going to be losing a lot of points from your paper if you do this. So be really careful. Remember that ELFTs is 2 different investigations. And also, you know, another example of that is ultrasound and mammography. Ultrasound is 1, mammography is another. So if a particular investigation has an MPS item number, then that makes it an individual investigation. So some more KFP tips for you here. Another common mistake is not being specific enough. So really try to be as specific as you possibly can be with your answers. So if a question asks about management, don't write further history taking questions. If you write referral, say who you're going to refer to and what for. If you write reassurance, that's not enough. You need to say, for example, reassure the patient that the condition is benign and will improve in 2 weeks, for example. If you write follow-up, say exactly when you're going to want to follow that patient up. Remember that you're in general practice, so this exam is written by GPs for GPs, so you don't need to give answers that are the equivalent of what a surgeon or cardiologist would know. It is really helpful to use Murtaugh's safe diagnostic strategy, because then you know that you're not missing anything important. Please write answers out in full, so don't use abbreviations. If in doubt, write it out. I say that over and over again, and people still write abbreviations. You know, an abbreviation that you think is obvious may not be obvious to the marker, so you don't want to miss those marks when you know the answer. Consider using the appropriate language. So if the question is asking you what you would say to a patient, make sure you're using lay language. And do take care with your spelling and your meaning. Marks aren't going to be deducted for spelling mistakes if it's clear what you mean, but if it's completely wrong, then yes, they won't give you the mark because they won't know what it is that you're trying to say. So now for some general advice about the examinations and your preparation. So the RACGP uses the BEACH data, which is the frequency and prevalence of presentations to a general practitioner. And they use these to decide what weightings different presentations will be given on the exam. So, for example, you know, respiratory is a common presentation, so you're going to see a lot of respiratory questions on the exam. Now, this is over the 3 exams, so that they try to do this over the AKT, KFP, and OSCE. So, if you know there's a lot of diabetes on your KFP, you're probably not going to see much of it on the OSCE, for example. So this is also a guide to what you should study. So you should be studying a lot of respiratory, a lot of musculoskeletal, a lot of skin, and if those are your weak areas, you should be studying those even more. I think one of the most important things to do as you prepare for the exam is to identify your areas of weakness. So, you know, for you, is it mental health? Is it musculoskeletal? What is it that you really need to work hard on to improve your knowledge? So I think to figure it out, first of all, look at your practice. So what sort of cases are you seeing all the time? There'll be your strengths, and then what cases are you rarely seeing? There'll be your weaknesses. So for me, I'm a young female. I see a lot of young women, families, kids. So, you know, my strong points would be women's health, pediatrics, antenatal care, for example. I really don't see a lot of diabetes. I don't see a lot of men's health. So those would be the things that I would swat up on. also, what are those conditions when they walk through the door that stress you out? So, if there's a red eye, is that something that you sort of go, oh, I don't know? If somebody has a sore knee, is that something that worries you? And those may be the areas that you do need to work harder on. About a month prior to your exam, the RACGP will send you an email, and that will give you a link to a practice exam that you can do. I recommend that you do that as soon as you can after you get the email, because that after you finish that exam, it will show you what your areas of weakness are and what your strengths are, and then you'll still have a few more weeks to work on those areas of weakness if you do it early, and that can be a really, really useful tool for you as you prepare for the exam. Please become familiar with your guidelines. So the RACGP Red, Green and Silver books, your immunisation handbook, your Heart Foundation guidelines, SNAP, diabetes, asthma. The guidelines are really, really, really important. A lot of people say to me, oh, I'm just going to read Murtaugh. It's not enough. You need to know your guidelines as well. So when answering your questions, do consider the domains of general practice, and you'll see those are written there. Some resources for your preparation aside from your GPrEP study groups. The RACGP does have a good DVD resource that's available. The GPRA has some useful study tips, and so you can Google that. AFP is great. I would use it for specific topics and not just try to read 3 years worth of AFP, because it can be quite broad. The CHECK program, I can't say enough how important CHECK is. It's really good, in particular for your KFP preparation. There's MCQ Bank and BMJ on examination, which are some useful multiple choice questions for you. However, I personally think they're a little bit easier than the RACGP questions, and also they are UK specific. So, you have to be a little bit careful with using those. But if you just want to practice MCQs and get used to doing them, get used to your timing, then they can be useful. So with the Facebook study group that I run, we'll be covering a topic each week, and I have listed those topics for you at the start of the study group. So over the 20 weeks, we'll cover a topic each week. I'll give you on a Friday what topic we're going to cover and what resources I recommend that you read. You'll find that those resources I put in order of what I think is useful. So even though I'll list multiple chapters of Murtaugh, for example, the top ones are the ones that I think are the best. And so read those first and then slowly make your way down. Because there is so much information out there for us, it can be difficult to know what to read, and so because of that, I've chosen to do a if you read nothing else resource this week. I do hope that you read more than the if you read nothing else resource, but if you really are strapped for time, then really try to cover those if you read nothing else resources. Sometimes, for example, in Cardiovascular Week, there are going to be a massive amount of resources in the if you read nothing else, but those are the things that I think are really essential for that week. So as I said, I'll give you your resources on a Friday, and I'll also include an example KFP question, and that's because I want you to do as much study as you possibly can over the weekend around those resources, and to have some time to sit down and work through the KFP question before you give your answer. On Monday, Tuesday and Wednesday, I'll give you either an MCQ single answer or an extended match question. And then on Thursdays, I'll be giving you the answers to all of the questions and an exam tip of the week, which I really do encourage you to pay attention to, because those exam tip of the weeks come from what the RACGP has told us are the most common mistakes that people make with the exams. So with the practice questions, please, please, please post your answers. So if everybody feels shy and doesn't put their answers up, it's not a particularly useful resource. But if you all post your answers, it makes a huge difference, because you can see what other people are thinking. And with difficult questions, if you post your reasoning for an answer, that's going to help other people as well. And so, together we can work through these questions and really get more of an idea of how to approach them. When I give you answers to the questions, I will give you individualised answers, particularly to the KFP questions. And I am going to be blunt about it. Don't be shy. You know, if you make a mistake, this is the perfect place to make a mistake, and we all will make mistakes as we go along. And I think it's useful for you and other people to see the types of mistakes that can be made, and for me to be very clear about those when I give you the answers. So that's it from me, everyone. I hope that I've given you a clear introduction to the exams. If you do have any questions whatsoever about this video, then please do feel free to ask me. If you have any questions at all along the way over the next 20 weeks, please feel free to ask me. I'm checking the Facebook page multiple times during the day because I do want to be able to get an answer to you to any questions within 24 hours. Also, if there's a resource that you don't have, you can't find, even a topic that is a weakness for you that you'd like resources on, just ask me, and I'm more than happy to get those for you. I really want to be here for you over the next 20 weeks and make this process as painless as possible. So do ask, and happy studying.